Hello and welcome to my presentation. My name is Sonia and I will be presenting on obsessive compulsive disorder. So, obsessive compulsive disorder, the DSM criteria, it requires uh, com obsessions to be present, which are intrusive thoughts, urges, or unwanted images. It must be present for the individual, and they're usually unable to ignore or suppress these thoughts. The compulsions are repetitive rituals or behaviors and the individual with OCD will feel, and they need to perform it. And the aim of this is to prevent something dreadful or event from occurring. The compulsions are time consuming, they cause significant distress to the individual, and also impairment in social or occupational functioning. So these symptoms are not caused by other medical conditions or effect of a substance, according to the American um, Psych, Psychiatry Psychology Association. Right. So the brain regions where OCD um, usually is basically there's several brain regions that are impacted. The orbital frontal cortex, there's decreased neuronal density in the orbital frontal cortex of individuals with OCD, and also the anterior cingulate cortex. There's over activation of the anterior cingulate cortex, which leads to the error checking, the getting stuck on certain thoughts aspect of OCD. And then the striatum, especially the caudate nucleus. The malfunction in this area of the striatum, which contributes to the repetitive compulsions in OCD. And then the thalamus, this is part of the brain that orchestrates the sensory and motor signals and its dysfunction contributes to the repetitive rituals as well. So, the brain circuitry involved in OCD. Basically, there's several hypotheses of how OCD comes about, but genetics and neurobiological factors contribute to OCD development. There's no specific gene that has been implicated in the development of OCD. So OCD is a disorder with dysfunction in a network of brain regions and not just one singular region. So individuals with OCDs have an anatomical dysfunction in the cortical striatal thalamo cortical loop. This creates an imbalance between the goal-directed system and the habit learning system. In the CSTC for short circuits, the orbital frontal cortex, anterior cingulate cortex, and coordinate nucleus are hyperactive and dysfunctional. And also in the CSTC area, this region is responsible for decision making, habit formation, emotional regulation, and motor control. And the dorsolateral prefrontal cortex and dorsal anterior cingulate cortex and basal ganglia limbic and thalamatic structures have all been associated with key neurobiological mechanisms that function within OCD. So the neurotransmitters involved in OCD, one of the theories that the neurotransmitter glutamate in the brain is associated with the CSTC module of OCD. And there's hyperactivation of the CSTC, which produces uncontrolled positive feedback loop, triggering the impulse to perform compulsions which then becomes habit forming and increases the need to perform them. The hyperactivity in the CSTC suggests an increase in glutamate levels in cortical striatal pathways and dysregulation of GABAergic transmission. This increase of glutamine has also been observed in the cerebrospinal fluid of individuals with OCD. And then some studies also suggest that dysfunction in brain serotonergic system may play a role in OCD development since SSRIs like fluoxetine, fluvoxamine, sertraline have been effective in treating the pediatric population with OCD. Some treatments for OCD include cognitive behavioral therapy with emphasis on exposure and response prevention. It's actually the gold standard of first-line psychotherapy to treat OCD, and also medication therapy, like we're learning. It's also medications like clomipramine, a TCA. Um, it's a great medicine for OCD treatment, but it is not approved for use for children under 10 years old because of the risk of sudden death in children. And also SSRIs such as fluoxetine, fluvoxamine, and sertraline, they all have the risk of suicide ideation in pediatric population. So in order to use those medications, you have to make sure you discuss the risks with the family prior to starting them. So these are my references for this presentation. Thank you very much for listening.